Good morning, everyone. Today I am going to take the topic of extractions in orthodontics. So coming to the introduction section of extractions in orthodontics, basically extraction is a painless removal of teeth from its socket, and it is one of the most common methods of gaining space in the arch. So what is the need for extraction? In which cases you have to do extraction? I will be explaining that in the coming slides. So the main indication for extraction is the first one, that is arch length tooth material discrepancy. That is if there is any change or difference in the proportion of the patient's arch length or tooth material, there will be a discrepancy which will result in the crowding or spacing. So if the arch length is more and the tooth material is less, there will be a chance of spacing. And if the arch length is small and the tooth material is higher or increased, there will be chances of crowding. So that is the first main indication of extraction, that is arch length tooth material discrepancy. So next one is the correction of sagittal indel arch relationship. So we have know that the basic or the ideal molar relationship is class 1 molar relation. So if a patient having class 1 molar relation with severe crowding or bimaxillary proclination, you have to extract all first premolars. So in most cases, the class 1 malocclusion, it is preferable to extract in both the arches because it is not advisable to discourage the development of only one arch more than the other. That is the first reason. And in some other cases, you can see that it is a class 2 molar relation with abnormal upper proclination. If there is only upper proclination and we have a sufficient overjet, we can extract upper fours, that is upper first premolars 1 4 and 2 4. You can extract for a class 2 molar relationship case with an abnormal upper proclination with increased overjet. But in the case of molar relation class 2 with minimum amount of proclination, but the lower arch also have an exposed with or have a proclination or a crowding, you have to extract both the arches. That is, in a class 2 molar relationship, you have to extract upper fours and lower fives. There is a lower first upper first premolars and lower second premolars. So that is the extraction pattern for a class 2 molar relationship case. So in this case, we are extracting the lower premolars for the correction of the molar relationship. That is class 2 molar relationship into a class 1 molar relationship we have to make. So for that, we are extracting the lower arch. Next one is the class 3 cases. That is, in class 3 molar relationship, we can either extract only the lower first premolars, or if you are need to change the molar relation, that is class 3 to class 1, you have to extract upper fives and lower fours. So next is the extraction for the relief of crowding. So that is, in some certain cases you might have a fractured tooth or a hypoplastic tooth, grossly carious teeth, root canal treated teeth, and teeth with large restorations. If you see such tooth, you have to extract those tooth compared to the healthy tooth. That is the condition of the teeth that is important for the extraction for the relief of crowding. And next one will be the position of the crowding. How the tooth is positioned in the arch, which will determine the extraction. For example, the crowding in one part of the arch is more readily corrected if extractions are done in that part rather than a remote area of the arch. And the first premolar positioned in the center of each quadrant is usually near the area of crowding, whether in the anterior or buccal segment, and hence it is also the tooth most frequently extracted along with orthodontic treatment. Next is the position of the teeth. Grossly malpositioned teeth, that is, if one tooth is migrated to the other side of the arch or somewhere else which is very far from its ideal position, you can extract such tooth instead of a normal tooth which is in the correct position. So coming to the different extraction procedures. So it includes the balancing extractions, compensating extractions, phased extractions, enforced extractions, Wilkinson extractions, Stobie's extractions, serial extractions, and driftodontics. So coming to the balancing extractions. So balancing extractions may be defined as a removal of a tooth on the opposite side of the same arch. So if you are extracting opposite side of the tooth of the same arch, that is, if you are extracting 1/4, you are extracting the corresponding arch 2/4. And if you are extracting 3/4, you are extracting the 4/4. That is mainly in order to preserve the arch symmetry. And other extraction is compensating extraction. That is, if you are extracting 1/4, you are extracting the opposite side arch the same tooth. That is 4/4. And 2/4 you are extracting the 3/4. That is the compensating extraction. That is mainly you are preserving to maintain the lateral symmetry of the arches and the buccal occlusion. Next one is a phased extractions. That is, if you are extracting a tooth in 1 month, after few months you are extracting the other tooth. So the extraction which is happening in a phased manner is known as the phased extractions. The next one is enforced extractions. These extractions are carried out because they are necessary, as in the case of grossly decayed teeth, poor periodontal status, fractured tooth, and impacted tooth. So coming to the Wilkinson extraction, what do you mean by Wilkinson extractions? That is, Wilkinson advocated extraction of all four first permanent molars between the age of 8.5 and 9 years. So the basis of the fact that the first molars are highly susceptible to the caries, that is the reason. The other benefits of extracting first molars at an early age are to avoid the third molar impactions and to reduce the crowding in the arch. And the Wilkinson's extractions are not usually carried out because of various drawbacks. Because first molar extraction will not gain much space for the crowding correction, and second bicuspid and second molar rotate and may tip into the extraction space. So it is not commonly advocated. Next is a Stobie's extractions. Extractions of two premolars at the same time is Stobie's extractions. And serial extractions, which is a concept put forward by Jelgren, and Nance is known as the father of serial extraction. That is, certain deciduous teeth and certain permanent teeth you are extracted at an early period of time to prevent the crowding. Next point is the driftodontics. This concept is applicable when extraction of the permanent teeth are done without the appliance therapy, and teeth have a natural tendency to drift into the extraction space. That is driftodontics. Next is the choice of teeth for extraction. Which tooth you will extract in a particular point of time. So these are the topics, or these are the things you will need to know before extracting the choice of the teeth. So direction and amount of jaw growth you have to consider, discrepancy between size of dental arches and basal arch, state of soundness, position and eruption of teeth, facial profile you have to see, degree of dental-alveolar prognathism, age of the patient, and state of the dentition as a whole. So coming to indications of extraction of different teeth, which teeth you have to extract in a certain cases. So see this picture, you can see the amount of crowding. So in these cases, you can extract a maxillary incisor to correct the crowding. So indications of extraction of a maxillary incisor, if it is unfavorably impacted, if it is totally blocked out, and if it is a grossly carious tooth or any malformed position or malformed incisors that cannot be restored with prosthesis, in such cases you can extract a maxillary incisor. It is the least common tooth for the extraction or as a choice of extraction. These are the least preference for extraction in a dental arch. Next one will be the extraction of the mandibular incisors. Mandibular incisors are extracted only if the tooth is completely blocked out, or if in case of such arch material tooth size discrepancy or a Bolton's excess. In the case of a class 3 cases, you can extract a mandibular incisors. And canines are extracted only if it is ectopically erupted or it is very unfavorably impacted. You can extract a canines. So these are the different situations. In the first picture, you will prefer to extract the lower lateral incisors, and in the figure 9, you will extract the upper right canine compared to the first premolars. So next choice of teeth for extraction is the first premolar. This is the most commonly used tooth for the extraction procedures in the cases. That is, it has an ability to relieve moderate to severe crowding and procrastination. And next one is the extraction of second premolar. That is to relieve a mild crowding and procrastination where anchorage loss is desirable. In such cases, you will extract second premolar. That is, if you extract second premolar, there will be chances of mesial migration of the molar tooth, which will help in the loss of your anchorage. In such cases, you will extract second premolars. So these are the different situations where you need extraction of certain tooth. So in the figure A, that is unfavorably or highly placed canines, and figure C, it is bimaxillary procrastination cases. Figure E also bimaxillary procrastination cases, and in the right side A, it is completely lingually placed premolars. In such cases, you can extract that premolar. So first molar, when you will extract first molar, if there is a minimal space requirement to correct mild crowding or procrastination, you can extract first molar, but it is not commonly extracted tooth for orthodontic purpose. Or if the first molar is completely or grossly decayed or it is heavily filled, you can extract that tooth compared to other tooth. Second molar also, in some cases you will extract second molar to prevent the third molar impaction, but it is also not commonly employed. And to relieve the impaction of second picus, within certain cases you can extract second molar. And to enable distalization of first molar, you can extract second molar. So when you will extract a third molar? So in some cases you are extracting third molars before the starting of the orthodontic treatment. It is not because of for orthodontic treatment. It because of any pain in the third molar region, because of the unfavorably impaction in the third molar region, you can extract third molar. It is not actually for the orthodontic treatment you are extracting the third molars. So conclusion, extractions are done depending upon the choice of treatment by orthodontics. So when to choose, which tooth to choose for the extraction depends completely on the orthodontics perspective, and if for which tooth you will extract, which will benefit the patient, and that is also a concern before extraction. So you need a deep knowledge of the treatment mechanics. So to in order to before if you are extracting a tooth, you have a thorough knowledge is required. So they are done to give a perfect smile ideally. So thank you.